Live, local, late breaking. WPBF 25 News at 9 starts now.
The Promise Fund of Florida is making a promise to help fight breast cancer across the Sunshine State. Next, we'll speak with the co-founder about how the community can join in on the fight. Welcome back. A sister's promise has turned into an international movement to fight breast cancer. And now Nancy Brinker, the founder of the Susan G. Komen organization, is continuing that promise through an organization called the Promise Fund of Florida. So, Nancy, first of all, thank you so much for being here.
Thank you.
As we all know, I mean, you've dedicated your life to fighting for breast cancer patients and their families. Why did you start this new initiative?
Because, Gianna, Florida has a very fragmented healthcare system. We want to focus all of our efforts. To begin with, in Palm Beach County, we're developing a model to deal with low-resource people who do not have access to care, and we want to make sure that they get it. And we want to also say, you don't need to be wealthy to be healthy.
Right.
We will operate our organization with patient navigators who will outreach to people who need services and make sure they get them. And the important thing to remember is every dollar we raise stays right here in Palm Beach County to help our neighbors.
Yeah.
We are all neighbors, and we need to be able to help each other.
And I think people really love that when they give and they know that that money stays here. They know they're helping their family members, their neighbors, the person down the street. I think that that's so important.
And these two diseases, breast and cervical cancer, are absolutely curable, found in their earliest state. So it's our goal to screen women. Right now, only 80% of the women all over Florida are being screened. Why? We also want to change policy to make sure that doesn't happen. We have 100% of people screened and taken care of.
Yeah, talk to us about some of those obstacles, because that's really your mission, is trying to remove those obstacles from people and get right to a diagnosis and treatment.
Right, and part of the obstacle is just the barrier of trust people don't have because they don't have a physician. We will provide patient navigators to get people through a complex system. We will also work with providers in our community to make sure that physicians and others will give maybe reduced cost for their services so that we can get people treated. Because we know for sure, again, when we screen early and we get people in for any early disease, we have a great chance of returning them to private, to good and productive life.
You
know? And it's all about that. And not, you know, having someone literally go broke with care. Remember, you don't have to be wealthy to be healthy.
Right. I love that. Why is that kind of your mantra for this?
Because it's true, because it shouldn't be that way, because we live in a neighborhood. Our county is a neighborhood. Every community is a neighborhood. And we have to really care for people who we know are having some issues. The healthcare system is very, very fragmented here. Difficult to find your way through. We're going to try to change that. And we're creating a model. And we hope other people from other counties in Florida use this model. And frankly, all over the United States.
I was just going to say, yeah, everywhere.
It's really important. And we need to roll up our sleeves and get it done.
Now, describe some of these patient navigators that we talk about in the organization.
Well, we have a wonderful one, Liliana Hernandez, who's just incredible. And we are bringing on, by funding through different organizations, finding women who are community competent, who are members of their own community, to reach out to people in that community. It makes sense. If you and I are culturally alike, we can share things that maybe we wouldn't if we weren't culturally alike and had the same background. So our navigators will be prepared to deal with whatever community they are in, bringing people to care. Sometimes it's just simply a very low level of care. It's a screening and they're fine and they move on. Other times it's more complicated. And that's what we want to walk people through.
Perfect. So for people who are sitting at home right now and they're thinking, I got to help, I want to do something, how can viewers support this amazing
website? PromiseFundOfFlorida.org. PromiseFundOfFlorida.org. Any gift is, no gift is too small, no gift is too big. It stays right here. It helps our neighbors. We just shouldn't have these problems, and we won't if you support us.
Perfect. Nancy, thank you so much for being here. And if you want some more information about the Promise Fund Florida, you can, just like you heard, go to PromiseFundFlorida.org. Give. We have such a giving community, so I know people are going to be logging on right now.
And thank you, Gina. Thank you so much.
Of course, this is great. Really important to get the word out.